how this stuff affects our body and how we need to be smart about how we handle alcohol. So this is more about education and awareness, because what you don't know can affect your blood pressure. It can affect your heart. It can affect your kidneys, your sleep, and even your medications. So today's thing is on alcohol, and it's really sip smart, understanding alcohol and your health. And as always, this show is for education only, not medical advice. Always talk to your doctor about personal health. And if you have an emergency, call 911. So let's start simple. When you drink alcohol, whether it's beer, wine, or liquor, it actually enters your bloodstream very quickly. And your body treats alcohol kind of like a toxin. So that means, and the thing that clears out this alcohol is actually your liver, and your liver has to work hard to break it down. The problem is that your liver can only process approximately one drink every hour. And when you drink more than that, it actually builds up in your system. And what happens when that happens? When that happens, this that it starts affecting multiple organs. So in your brain, you get impaired judgment, impaired memory. Your heart. You might have some blood pressure issues, and actually some arrhythmias. It can affect the fluid balance with the kidneys, and the liver over time can get damaged from chronic regular drinking, and also from what we call binge drinking. So even though alcohol is common, it's not as harmless as we think it might be. Okay. So of course, I do blood pressure. So let's talk about something that we care deeply about, and that's blood pressure. And alcohol can raise your blood pressure. And this is something a lot of people don't know, especially if you drink regularly or if you binge drink. And that's when you do multiple drinks in one sitting. And heavy alcohol use can contribute to people having high blood pressure. That's something that a lot of people don't know. There can be stress hormones. Well, it can also disrupt your sleep, which people don't know much about. And this stuff can all lead to high blood pressure. And remember, high blood pressure is a number one risk factor for stroke. So it's not nothing to just kind of take lightly. So when someone says it's just a drink, you have to know, what is it doing to your numbers. So if you're drinking on a regular basis, this may be contributing to your high blood pressure. Okay. So, of course, bringing it back to kidney health, the kidneys are responsible for, balancing fluids, controlling blood pressure, filtering waste, and alcohol can affect these things. It actually can lead to dehydration. This is one of the reasons why we tell people to drink water, okay, whenever you're drinking alcohol. Kidneys can work harder. It can worsen existing kidney disease, especially by its effect on high blood pressure. And for people with diabetes, high blood pressure, kidney disease, alcohol can quietly make things a little bit worse over time. Not overnight, but gradually. And like I said, and that's what makes it dangerous, is because it's not something that happens immediately afterwards. It's something that happens over a longer period of time. And there's another thing that people really don't think about, and that is that alcohol can interact with some medications. Some of your blood pressure meds, diabetes meds, sleep meds, pain medications, and so there can be a combination between those two. So that if you're taking some of these medications, and you add alcohol to it, it might can exacerbate certain aspects of those medications, or like I said, you might be a little more sensitive to the alcohol. So all these things. So this is something that people don't really think about. And actually, sometimes there are warnings on your medication to not drink with alcohol. But even if it's not theirs, you want to make sure you check with either your doctor or your pharmacist and just ask, especially if you're drinking on a regular basis. So some of these combinations can cause your blood pressure to lower too much. You can get dizzy or fall. Of course, the liver damage, like I said, especially if you're drinking on a regular basis, or like increased risk of bleeding, depending upon the type of medications there. And especially for folks that are a little older, even one drink can hit a little differently. So you got to be cautious with that. So if you are taking medications, make sure that you ask your doctor or pharmacist, is it safe for you to drink with this medication? And so that's always a great question to ask. And this is especially important for those people who drink on a regular basis. But even if it's just, like periodic, you always want to ask if it's safe to drink alcohol with the medication. Okay. So now let's talk a little bit about balance because we don't really, because a lot of times we say, oh, moderate drinking is okay, a little bit's okay. And so drinking in moderation, we say this all the time, but we don't always know what that means. So, according to guidelines, men usually can have up to 2 drinks per day, and women usually up to 1 drink per day. But a lot of times people don't understand that that's really a maximum. That's the maximum recommendation. Is not the goal. So they don't want you. Nobody wants you drinking 2 drinks a day or 1 drink a day. That's the maximum you should be taking. And for some people, it depending on how sensitive you are, the safest option is going to be no alcohol at all. So some people just really can't handle that. And especially if you have high blood pressure, kidney disease, liver disease, especially, or another one that's a history of addiction or a family history of alcoholism. Those people probably should stay away from alcohol altogether. The other thing is that if alcohol is affecting your sleep, your mood, or your medications, those people actually should avoid alcohol also. Okay. Now, there's another thing, and this is a kind of a mental health connection, because a lot of times people use alcohol to deal with stress, to deal with loneliness, to deal with anxiety, to deal with pain. But the alcohol is actually a temporary escape. It's not a long-term fix. It's a temporary escape. But the problem is this, and that is long term, the alcohol can actually make the depression worse. It can increase anxiety in some people. And this is another one that people don't really realize. It actually can disrupt your sleep. So the alcohol that you're using to deal with, you know, mental distress on a short-term basis can actually over a long term be worse for you. So it's not a it is as a coping tool, it's actually not a good coping tool, especially when one is doing it on a long period of time. So so if you're drinking because your mood is low, you got anxiety, and there are people that literally treat their anxiety with with alcohol, a beer, a couple of shots, and they feel like that makes it better. But over the long term, it can make things worse. And so, what you want to do is you want to look for different alternatives to try to help manage these mental conditions. So, talking to someone, getting a counselor is good. You want to exercise, that can kind of help out a lot of times. Prayer, meditation, those work. And then, of course, community support can also be good tools to deal with your kind of mental distress. Okay. So now, for in terms of practical tools or smart ways to kind of deal with alcohol, some of here are a couple of practical tips. So if you are going to drink, set a limit before you drink. So if there's anyone that has had experience with alcohol, once you start drinking, you do not have good judgment. Okay. So if you start drinking, you're not going to set your limit, while you're drinking. Matter of fact, even if you set the limit before you drink, it's going to be a little tough. But you want to set a limit before you drink. 1 drink, 2 drinks, hopefully not 3, but it is what it is. So set your limit before you drink. This can kind of help guide you a little bit. If you have a buddy that's willing to look out for you, let them know as well. Hey, look, I don't want to drink any more than 2 drinks a night. And that way, when you start reaching for the third one, they can kind of smack that hand away, right? So get away from the bar. The other thing you want to do is alternate alcohol with water. And like I said, alcohol can kind of be dehydrating. So you definitely want to make sure that you're drinking water, keeping yourself well hydrated whenever you drink alcohol. Another one, do not drink on an empty stomach. That just makes it easier to absorb that alcohol a lot faster. I think this is one that a lot of people are probably have experiences with, but if not, like I said, don't drink on an empty stomach because, like I said, that alcohol gets absorbed a lot faster. You want to avoid binge drinking, and some people don't consider themselves drinking because, oh, I'll drink during the week, but on the weekend I put away a six pack or half a case or something of that nature. That's binge drinking. And like I said, that actually can add up as well, and is not as safe as a lot of people think it is. Okay. And then you also want to track how alcohol affects your sleep and blood pressure. So for the blood pressure, monitor your blood pressure, see how what it does when you are drinking, and then see how it is when you've been off alcohol for a while, and see how that works for you. The other thing is sleep, and one thing about sleep, and that is that yet do you go to sleep quicker for some people? Yes, but it does affect your deep sleep, and that's the sleep that's kind of restorative. And so while it might get you to sleep quicker, you don't get that. It can interrupt the deep sleep that you need to be restful. Okay, and then also have alcohol-free days. If you're drinking, that drink a day, then have some alcohol-free days. Have a couple of days that you don't drink at all, not even with dinner or anything of that nature. Kind of back off a little bit. And probably the biggest thing is to be honest with yourself. So that is one way to find out, you know, where you are in terms of this, consuming alcohol, and that is being honest with yourself. You want to make sure that you're not minimizing how much you're drinking. You want to make sure that you're not, trying to make excuses for why you're drinking. You just want to be honest with yourself. Hey, I drink, two shots of gin a day, or of course, sometimes I get people say, yeah, I drink a fifth of some, alcohol of choice a day or a week or something of nature. And in addition to being honest with yourself helps you be honest with others, especially your physician, especially your clinician, because that is how we can help to monitor how much you're drinking, and also how we can help them to determine whether or not that drinking may be affecting, various conditions like your high blood pressure, like like I said, if you got, if you're starting to develop some cirrhosis or something of that nature, if you've been honest, then someone can say, hey, this is contributing to, the reason why you have this condition, and be a little more stringent about the fact that you may need to either cut back or stop altogether. Okay. So that's some things that we really want people to know. We really want you to be aware of. And the other thing is we're going to provide you with is, we want to make sure that um, some of the top 10 myths about alcohol. And we kind of mentioned a little bit of it here, but we're just going to go over this before we kind of get to the end of the show. And that is, one is that alcohol helps me sleep. And like I said before, it can help you to hit that, to actually close your eyes and get that initial reps, but it actually can disrupt your deep sleep and cause poor rest. So yet again, a lot of these things, especially if you're doing it on a regular basis. Okay. And then one is that wine is good for your heart, and that's a little, I was maybe controversial is the right word for it, because some people think that these benefits are overstated, and the risks still exist even with alcohol that's in wine. And then we got another one that says, this is going back to the binge drinking. I only drink on weekends, so it's fine. And not always. I mean, the binge drinking can be harmful as well, especially if it starts, it goes from, binging, once every 3 months to binging every weekend. This starts to add up again. Okay. Another one, like I said before, alcohol doesn't affect blood pressure. It does. Alcohol can raise blood pressure significantly. There are people that I've seen that they were drinking on a regular basis, had high blood pressure, came off, blood pressure comes down. So it's not as benign as you think, and it does need to be reported to your doc, especially if you have a diagnosed high blood pressure, and especially if you're getting a new diagnosis of high blood pressure. One of the things you want to say is like, hey, look, yes, you may be getting prescribed medications, but let your doc know. Say, hey, yeah, just also, I'm drinking four beers a day, or a glass of, a couple glass of wine every evening, because that may be a behavior intervention that can be performed even before or in addition to getting prescribed blood pressure medications. Then, we talked about this a little bit. I can drink safely with medications, and that's a dangerous assumption. Many interactions exist, so you have to check and see whether or not the meds you're taking can be safely consumed with alcohol. And then another one is that beer is safer than liquor, and alcohol is alcohol. Honestly, like I said, the difference is the concentration. So you have to drink more beer to get the same amount of alcohol as in liquor, as in the same volume of liquor. However, alcohol is not necessarily safer. It's just that you have to consume more, in order to get to the higher alcohol levels. And then the other one, I don't feel drunk, so I'm fine. And this definitely goes to people that drink, the 1 and 2 drinks a day. And that is, the damage can still occur even though you're not getting drunk. Drinking on a regular basis can still cause a damage, especially to the liver. Okay. Alcohol, this one, of course, everybody's gonna recognize this one. Alcohol helps with stress. This is a temporary relief, and over time, can worsen anxiety. And then also your body can get literally addicted to the alcohol, so that when you do stop it, you start getting those tremors. Your body will get to the point it actually needs it. Okay. The other one is that I can sweat it off or sleep it off. Your liver still got to process it. Once you drink it, the liver's got to process it. It's got to go through its process of clearing your body of that alcohol. It can still get damaged. Okay. And then moderate drinking is safe for everyone. And that's not true, because some people should not drink at all. Like I said, if you certain chronic diseases, you should avoid alcohol. Also, people with histories of addiction, and especially family histories of alcoholism, really should probably avoid drinking at all possible. Okay. So that's kind of our top 10 list. And so for today, I think we're going to go ahead and wrap this up. So, and as we wrap up today's show, I just want to leave you with this, and that is, alcohol is common, but it's not harmless. So even though you see it everywhere, there are advertisements all over the place, everybody makes it seem like it's cool. Just remember that this is not that the body is treating alcohol like a toxin. And don't get it wrong, the more you drink and the more frequently you drink, the more likely you are to get the harms of alcohol. But even lower doses of alcohol can be harmful, especially in certain people. Okay. So small changes can lead to big improvements in your health. So if you're binge drinking on a regular basis and you cut back, that can be helpful. If you're drinking multiple drinks every day and cut back, that can be helpful. So just those small changes can lead to big improvement. So you want to make sure that you're being honest with yourself. You want to make sure that you're being honest with your physician or clinician, so that they can help you with this as well, in terms of assessing the risk to your body, or the likelihood that your drinking may be contributing to your chronic disease. So you want to make sure you do those. And then in terms of your action plan for this week, we always got to have an action plan, right? You want to know your numbers, especially like your blood pressure. You also might want to know your liver enzyme numbers. Be mindful of the alcohol you intake. Talk to your doctor if you have questions. Make one healthier choice this week. All right, make one healthier choice this week. And if you need help managing your blood pressure or got questions about your kidney health, remember PressureMD, www.pressuremd.com is here for you. Personalized visits. We offer telemedicine as well. So, and don't forget to, if you like what you hear, if you think this is important, or if you know somebody that might can benefit from it, feel free to like, follow, share, and subscribe to PressureMD Academy. Yet again, thank you. Thank you for following. Thank you for watching. I really appreciate the time and attention that you've given to us. We really appreciate this. So until next time, this is Dr. Brown reminding you, you that your health is your greatest wealth. Take care, and we will see you next week.
All right, Dr. Brown with the Health Facts here on Good with us on WVOE. Thanks so much.
All right, thank you. Take care.
Yeah, we're good.